like to take a moment to talk to you a little bit about tummy tuck and what I do and how it's different than what other surgeons do. So first off, pain control. There's a unique mixture of pain medications that I use to help reduce pain after tummy tuck. And this is very important because many patients have heard, nightmare stories from their mother or from a friend about pain after surgery. I utilize a proprietary mixture of several medications that we give before surgery via IV and injection, during surgery and after, in order to make it such that my patients say that their pain is between 0 and 1 out of 10. I know, it's unbelievable, but if you actually check out the videos on my Instagram and in social media, you'll see many women the night of, the day after, 3 days out, 1 week out, all saying the same thing. That number one, their pain is very low, again between 0 and 1, and number two, that they didn't believe it was going to be possible. It's really important, and it's only believable if you see it through their eyes. How is it possible that I can do this, that I can provide a low pain tummy tuck compared to what everyone else is saying in plastic surgery? Well, again, it's the use of these very special medications. Before surgery, I inject with anti-inflammatory medications and pain medications so that your body's numb before we even touch it, before we do a surgical procedure. That's key because if the body is numb before the procedure, the brain, even though you're asleep, doesn't perceive the pain coming from the body. That's called gating theory. And if we reduce if the gate never gets opened for pain, even when you're asleep, then afterwards your body's not primed to feel that painful sensation. The second thing that I do is I use IV forms of anti-inflammatory medications that help to reduce inflammation that happens during surgery and right after. Because inflammation in those inflammatory pathways can also trigger pain through other avenues. The last thing is I utilize an injectable form of pain medication that lasts for about 5 days. This medication is very special and it's injected right where the nerves come out of the body. This is very different. It's done during surgery to really target the body's ability to sense pain in the areas that we're operating. And again, the combination of its long-acting nature and the special way that I put it in makes it so that it works very well at reducing pain in that post-op period. Again, sounds too good to be true. How is this possible? Well, the medications, the way they're injected, all those things. And how do we know that it works? Well, there's the videos of those patients that I've told you about, but I've also worked on several publications to detail the quality of this medication. And those publications are going to be out in the literature so you can see exactly what the pain expectation should be for patients before, during, and after surgery. Now, the second thing that I do that's very different is I utilize sutures on the inside to recreate the native anatomy of your abdomen. This is very important. Those sutures on the inside help to recreate the hills and valleys of your tummy, the line down the middle and the lines down the sides. We've all looked online and see tummy tucks that look like a flat board or a pulled shirt. They look odd, they look operated and strange. It doesn't look like a natural tummy. These sutures on the inside help to recreate those shapes so that your tummy looks natural, it moves natural. And I think that that's a critical part. Those sutures also do another important thing. They help get rid of the space where fluid can accumulate. So I don't have to use drains with my tummy tuck. This is really important because the number one complaint of tummy tuck is pain, the number two is drains. People complain about having to deal with them in the post-op period. Well, if we don't have to use drains, then the recovery is that much quicker and that much more tolerable by patients. The last thing that those sutures do on the inside is they're applied with tension over distance. So we're pulling the skin down, putting a suture, pulling it down, putting a suture, pulling it down, putting a suture. So at the end, all the tension has been taken off of the skin above, so that the skin that comes together in the panty line where the incision is, it comes together with no tension. If there's no tension, there's no pulling of that skin apart, then there's no thick, upraised, or wide scar. That's really important and critical because it improves the quality of the result, especially in patients that have darker colored skin or are prone to scarring. This helps to provide the best possible result because, again, no tension, no scar. And this is a concept that's well understood within plastic surgery and surgery in general. So as a recap, the sutures on the inside are doing 3 things. Number 1, recreating natural anatomy. Number 2, getting rid of drains. And number 3, giving you the best possible incisional closure and reducing the risk of bad scars or thick scars after surgery. Again, sounds too good to be true, Dr. Gould. Why is it that you do it this way, and 99.9% of plastic surgeons around the world don't do it this way. Well, all I can say is I don't know why other surgeons or more surgeons don't do it this way. But if you look back at the research and the articles that I've written, there's an article from 8 years ago of 451 patients, 6 years ago, 619 patients. In the last 2 to 3 years, additional articles all showing the same things. Number one, the results are good. Number two, the risk of complications, i.e. fluid collection inside, is lower when we do this procedure than if you use drains. And number three, the patients are happy with the results. These are all important considerations with regards to this type of tummy tuck surgery or drainless tummy tuck surgery. Again, I can't really tell you why more surgeons don't do it this way, but I can tell you I've given talks at the national and international meetings. We've gotten awards based off of these talks, and that we're part of continuing medical education and improving the thought process in plastic surgery about abdominoplasty, such that in the future, this will be a technique that is practiced by many more practitioners. If your physician is offering you a drainless tuck and they trained with me, they're probably pretty good at it because we've trained many doctors in Los Angeles how to do these procedures. But again, there's only a handful of people that perform a drainless tuck, and I think that the value of it is that main value is that it adds that shape back, that natural feel. So in closing, there's really two things that I do that are quite different. One is related to pain and the other is related to those sutures on the inside. And these are all things that contribute to the result and the quality of the outcome, and there are things that I do that are different. Now, there's a few things that I do that are similar to what other surgeons do, but they're very important to understand going forward with a tummy tuck. They're related to the function of your body. Three things are functional with regards to the surgery. Number one, putting the muscles back together in the midline to restore your abdominal core strength. That's critical after having had a child or you've had some stretch that's occurred along the muscles in the midline. Putting those muscles back together gives you core strength back and strengthens your abdomen in a way that gives you more control over your body. Number two is related to the mons, which is the skin above the vagina. The same way that the tummy skin stretches and drops over time, the skin above the vagina can stretch and drop as well. We do a tummy tuck and straighten this out. We also lift this skin too, so that things line up perfectly so that they're nice and flat. Also, it lifts the skin above the vagina, so it changes the shape of the vagina in a big way. This is important because of two key things that happen after childbirth. Number one is urinary outflow incontinence, and about 80% of women after vaginal childbirth have some form of urinary outflow incontinence. 4 scientific articles have shown that when you do a mons lift at the same time of abdominoplasty, you improve urinary outflow incontinence in about 90% of women that have it done. So that's a functional benefit. If you have to cross your legs when you sneeze or have a hard time at the gym, this will help. The other thing is related to sexual function. One critical article showed that by lifting the vagina, lifting the mons, it helps to improve the position of the important organs of sexual function. That improves sexual function in a big way. So you're getting 2 functional benefits in one by lifting the mons. So those 3 overall functional benefits: abdominal core strength, urinary outflow incontinence, and sexual function. Now, the last thing that I'll say is that when women come to me for this surgery, they don't just say, take skin off, right? They say, I want a better looking body. So I always do liposuction at the same time that I do abdominoplasty. It's usually called a Lipo Abdominoplasty. And that's so I can target areas along the flanks, along the upper kind of chest wall, lateral to the breast, and posteriorly where the love handle region is. Because I want to further contour the quality of the waist and to bring it in tight. And I want to create a shape that looks like an hourglass. Nobody wants to look like a board after an abdominoplasty surgery. Patients want to have natural curves that match their body. Again, that's why I always do the liposuction at the same time of the procedure to further improve the quality of the results and to give you a better body, not just an abdominoplasty. These are all things that I do in my practice that address the shape on the inside, the functional aspects of your body, and the shape on the outside with regards to your form that I think create the best possible result for a tummy tuck surgery.